welcome to another episode of Dr. Dallas Unleashed. We're finally back. We've had a little bit of a break because of the holidays and New Year's. I'm Dr. Dallas. We have Amber Foglia with us as usual.
Ooh, full on last name. Yeah.
And Anjelica, we won't say your last name. We don't want too many creepers looking for you.
Right, that's right.
Anjelica.
But
if you really want to creep on her, I guess.
You can find me.
Yeah, okay.
No
her address is 123 Circle Drive.
Find me.
Yeah.
I'm just kidding.
But thanks, guys. Hopefully the holidays were good for you guys.
Yeah, they're great.
And,
Nice.
I think we have a really cool, interesting topic. This will kind of bring it to, plastic surgery, cosmetic surgery. And we wanted to talk a little bit about, how do you get ready? How does one prepare mentally and physically for a plastic or cosmetic procedure? And I'm really excited because we have Amber, who actually is having a surgery coming up
2 days
in a couple days.
Yeah.
And but she's had we'll say a similar type of surgery about a year ago, right?
Yes.
And I think we want to know, and all the listeners, how does, one get ready? And now that you're kind of a veteran, how are things going to change this time around? So
I feel like it's so different than last time.
Right.
Well, first off, you guys need to check us out on YouTube. So all our podcast videos are on YouTube, and I actually vlogged my first surgery.
Right.
So it's on our YouTube channel, so you guys can check it all out. I'm super raw, and I kind of tell you how it is.
Super raw.
Really open about experience.
Talk about sex after plastic surgery, bruising. I go into all of it. But last surgery, so this will be my third round of liposuction. So I had liposuction first when I was 19.
Oh, wow.
Yeah, totally.
So bad. Don't recommend that to
anyone.
You were
so tiny, so thin.
I was so small. I don't even know why I did it. It was really stupid.
You're like, it'd be like Anjelica saying like...
I was like 116, I think, 116 pounds, and I'm 5'7".
Right. So if your BMI was probably like
super
below
low.
24, probably like 20, 21.
Yeah.
And people requesting liposuction, it's hard. You're not doing much. And I always tell people, the smaller you are and the less fat, you're asking for not these like huge inches change, but more like centimeters. And that's always really hard. To accomplish. And, sometimes it's like, well, if you really want to take that little change, maybe working out or going to the gym, but you had it though. And it wasn't a bad experience.
No, it wasn't bad. I will say I always had a little pouch, so I couldn't get rid of that little stomach area. So he liposuctioned that, but I did have some rippling after. Right. And I think it was just because I was so small. Right. But I had liposuction when I was 19. I was so young, I didn't know any better.
Yeah.
But last year, you did my tummy tuck. So I had a tummy tuck, lipo 360. So abdomen, flanks, back.
Right.
My inner and outer thighs, my arms, and my neck.
Holy shit.
Yeah. That was like a long day.
When it showed up on the schedule, I was like, holy shit balls.
It was like 20 hours, not really, but
no, it was
had
crazy.
To eat my Wheaties and everything.
Yeah,
and
that was a nightmare, right?
I cut out the bachelor party. I came home like at 4 a.m. because I wanted to be ready for you at 8.
Yeah,
that was bad. But I felt like last year I was way more prepared. Like I had everything ready.
Right.
This year, like I'm not prepared at all. And I feel like
this time around,
no, like I'm not prepared at all.
So tell us last time, like, how did you get ready? What were you doing? Did you eat anything special, take vitamins?
I did take vitamins. So I took a ton of vitamins before.
Right.
I made sure I wasn't drinking or taking any aspirin.
Right.
I had, I'm super OCD. So I had everything like labeled for my husband afterwards. I had like the bed prepped. I had meals planned. Yeah. Like I was psycho, but I took a lot of vitamins, just not drinking all that. Just taking care of myself. This time around, Saturday, I should tell you this, but Saturday I took aspirin. I was like, what the hell am I doing?
Right.
And I totally forgot.
Aspirin or crack?
No.
Oh my gosh.
It was aspirin.
We asked people to stop the crack pipe smoking.
I don't do drugs. Oh my gosh.
Yeah. But no drugs. Whether it's vaping or
no smoking,
marijuana, all that smoking will cause a decrease in the ability to heal. Yeah. And if you're doing fat grafting to the booty, which we do a lot of, the fat isn't going to stay.
No.
Yeah,
so we see a lot of people who go, I don't really smoke, but I have a little marijuana every once in a while. Even that can interfere with fat graft take. So if you want that nice big booty, you're not going to get that really good take because a lot of it's going to be reabsorbed.
Correct.
Yeah.
See, I don't smoke, but I haven't been taking my vitamins. But on Friday night, I started taking my iron supplements just because I know you're going to liposuction a lot.
Yeah. Yep.
So I want to take a lot of iron supplements just so I don't feel tired after surgery.
Yeah.
But now I just I have to get my black nail polish off tonight and put some light color. So
Yeah.
I don't know.
So
I'm way more nervous this time than last time.
Really?
But you guys remember last time my husband wasn't on board like at all.
Right.
And so that's hard, especially when you have a spouse that's not fully on board. And now this time he's like all about it. He's super supportive. So I think the first time was hard because I couldn't deal with the pain. I was super emotional. This time now I'm just scared because I know how psycho I get after surgery that I'm worried that I'm going to get like that again.
But this surgery, I feel, is not as big as the last one. So
hopefully he still lipos just as much.
There's not that much to take. You have like chicken legs, tiny little legs.
Amber,
tiny waist,
you are small.
tiny.
Don't you? I think you
big boobs.
You don't give yourself enough credit, but you know it's. And remember, we took off what
5 liters.
5 liters, almost 5 liters of fat.
Almost.
That is, you know, if you think about the Coke bottles that you drink and you buy like a 3 liter, you had like 1 and 2/3 of one. So, but it's a lot. And it's, you know, when you add a tummy tuck, you're tightening the muscles.
Yes.
It's, you know, let's get real. It's painful.
Yeah,
and we give people pain medication. I don't want you to think that, you know, if you have a tummy tuck or liposuction, you just have to suffer.
Yeah.
You get the narcotics that you need for a short time. And I think you know, in your case, right, we tell everybody, everyone has a different reaction. In your case, you got very emotional with that. Why don't you tell people, you know, how you were mentally kind of coping with stuff or maybe not coping with things.
I wasn't coping
right
very
afterwards. So kind of tell people why you think that was and maybe the medication.
I think a lot. Well, one, I wasn't honest with my husband, so I didn't have that support necessarily. He was on board, but he wasn't, so I kind of felt alone in it. And then the pain on top of it made me super emotional. So every little thing was bothering me.
Right.
So I was like crying. I was in pain. I couldn't control my pain. So I was just an emotional basket in this case. And then I got depressed because I'm so used to doing everything.
Right.
So then being helpless for a few weeks where I couldn't cook or clean or play took a toll on me. I think that was the biggest factor of why I got like depressed. I didn't start feeling good until probably about 8 weeks after surgery.
Yeah.
Really?
But I'm not the norm. I feel like I'm crazy, right?
Yes.
Well, it's always, you know, when you talk to people about surgery, I try to give them, they want to know what's the recovery like. And I want to give them kind of the average, right? You know, average is if you're having a lot of liposuction, tummy tuck, you have to take 2 weeks off of work, 6 weeks before you can go to the gym. And that's average. I don't want to tell, you know, someone like, oh, you know what? The best person that recovered from a tummy tuck, they were back at work in 3 days, right? Or look at Amber. It took her, you know, kind of 8 weeks to bounce back. But the average, and that's where most people will lie, is, you know, it's going to be about 2 weeks before you can go back and 6 weeks to recuperate.
Yeah.
But I think it's, you know, for people who are really interested in looking for more information, go to Amber's vlog or, you know, just listening here that I don't think your case will be like hers, but you know that even in its worst case scenario, look at Amber.
You'll get through it.
You'll get through it.
And I'm doing it again.
And she's doing it again.
It's addicting.
So, but I think you're right. I think having significant other.
Yes.
Tell us a little bit more about how that played a role with, you know, the first time and how it's going to be this time, right? Because that's pretty important.
Well, the first time, in all fairness, I didn't tell him I was going to have a dream. I didn't tell him about all the liposuction. Fail.
Okay.
I told him it was only like a 2 or 3 day recovery. I was not
2 to 3 day recovery.
And she used to do all the pre-ops for everybody.
I know. It was so wrong. So wrong. Don't do that to your spouse.
No.
I mean, I understand. You're trying to, you know, water it, make it easy for him.
Not worry.
But when you really couldn't hold it together, you needed that help. It kind of fell apart. You couldn't hold up this.
I couldn't handle
okay in 3 or 4 days. You really needed help, and he was like, "You didn't tell me this."
Correct. And also, he didn't want me to do the surgery because he was like, "You're fine the way you are. Just exercise and diet." And so I don't think he was 100% on board with it.
Right.
But now that I did it, and I obviously look a lot better, and now he's like so supportive. So the other day I was changing. He's like, when you do your surgery, I found another area you can liposuction. And you know what's so crazy? Most girls would be like, oh my God, I can't believe you said that. And I'm here like, where? Tell me, huh? Where else should I do it?
Because you want to get rid of everything.
I'd rather him tell me and be honest. But this time he's like super supportive about it.
Okay.
But I honestly believe this time won't be as bad, right?
Yeah.
I'm planning on only taking... my surgery's Thursday, and I'm planning on coming back to work Tuesday. When I did my first surgery, I was back to work at 11 days.
Well, you know, and this is a good lesson for everybody listening. When you have liposuction, you know, that first time around, you have the cannula in there and you're moving stuff, you're creating scar tissue, some scar tissue, and that's normal. And now we're going back again. So liposuction, there may be less to do, but I do have to break up some of that scar tissue. So I wouldn't say that because you're not having the tummy tuck muscle tightening, it will be easier, but I wouldn't poo-poo that it's going to be a little bit uncomfortable because of the scar tissue. And because anytime you repeat liposuction, you got to be a little bit more, aggressive breaking through that scar tissue. I think you'll be fine because you've seen the worst.
Yeah, totally.
When you did when you did her first surgery, did you feel the scar tissue from her previous liposuction before?
Not really.
But I had a tummy tuck though. Could you tell?
Because that was in the lower tummy that you had it.
lower tummy.
Yeah, so I'm actually getting rid of that skin in the tummy tuck. Right. So I actually, instead of having to lipo it, I was actually cutting it out. So it was not a big deal.
Yeah.
And everything was really soft and really pretty normal.
Yeah.
But this time around, I know because doing a lot of liposuction, I see a lot of repeats, whether I'm doing it on my own patients or people who come from other places. It's a real thing.
Yeah.
And some people have more scar tissue than others. I might be surprised, right? In 2 days, it might be really soft. And I'm like, you know what? I think you're going to, afterwards I can tell you, it's going to be super easy, the recovery, or easier because it wasn't real hard. Or I could be like, whoa, this was tough.
Right.
And and she might be in for a little bit more, but I'm hoping.
Your arm is going to be tired.
Well, when Sean picks me up that day, you can just tell him it was a breeze, man. You're good.
Yeah. Well, I'm going to.
At least he is a little bit more prepared on what to expect.
He is way more prepared. But I think that's important to have at least family or a significant other and just being honest with each other.
Right. And, I think when we do consults, we tell the patient everything, but I understand that, they're sort of gathering information. They just kind of want to hear, hey, am I a good candidate for this? Mm-hmm. And then when they come in, they say, okay, great. I'm okay with this. They're going to meet our patient coordinator. Mm-hmm. They go over the pre-op consents and a lot of things I talk about, what to do before, after, what to expect in recovery. Our patient coordinator will go over it once more. Mm-hmm. And so, I think it's just kind of hearing those things a couple times, but really importantly, like for you, your husband, I think it's important somewhere in there, maybe they're there for the consult or for the pre-op. Yes. Because if you ask the patient to relay all this information, it's just like anything else. It's going to come out, 25% is going to get to their ear. And then they're like, you didn't tell me any of this stuff. Yeah. It's just because, it's human nature not to be able to remember everything. So it's good to have your boyfriend, your husband, significant other, whatever it might be. And when we have guys, whether it's their wives or whatever, to hear that. Yeah. And that's important, whether it's a consultation or the pre-op. And I find the majority of people do bring in their significant others. Mm-hmm. Yeah.
But we did make a YouTube video on what to do prior to surgery or what to expect. Yeah. So you can check that out and we kind of go over all that. Right. I think that's a good reference because we go over so much information that after surgery you're like, oh shit, what did they say? Right. So that's a good kind of reference to bounce back to and watch those videos. But I'm excited. Right. Yeah. I'm scared, but I'm excited. But this is my last surgery until it's time for a facelift.
Oh my gosh.
I think it's important, and I really like your vlog because it does talk about the realness of it, that it is uncomfortable, that what is it like trying to be intimate again, and those are all real things for people to hear and prepare, because how many times do you see, whether it's on Snapchat or whatever, someone's like, oh, I had a wonderful experience, and here's my after, but they're not showing you what they look like maybe 2 or 3 days afterwards. Just today I showed a picture of someone who was a week out, a lot of bruising, getting better, but it's real, and it looks kind of strange, and if you're not prepared for it or have heard it, it's going to be like, wow, no one ever told me it was going to be like this. Yeah. So check out Amber's vlog on our YouTube channel.
Yes, I'm going to vlog this time too.
Yes.
Yes.
And for Anjelica, did you prepare for your surgery? Yours was a lot less.
Mine was a lot less.
But did you do anything special besides go out and party the night before?
I did go out the night before, which I shouldn't have.
Did you drink the night before?
Yeah. I had one.
So you don't like drinking? We can't drink the night before, right? Because blood thinner. Or what's your thoughts on that? Can I have a martini when I get home?
In all reality, it's probably okay because a lot of that is metabolized by your liver and it's out of your system, as long as you're not wasted.
Yeah.
No, yeah.
A single drink is going to be out of your system, probably 4, 5, 6 hours, so
1 or 2 cocktails are okay.
I would say one cocktail
probably.
is okay. But you're right, because it occupies the liver enzymes. And so while it's metabolizing, the worry is that you're not going to be able to clot as quickly because it's busy doing detoxifying the alcohols. So yeah, you don't want to overload it by, big surgery and then you got alcohol. It's not good. Plus general anesthesia, if your system is, sedated with alcohol, you're going to react differently to the inhalational anesthetic or anything we inject. It's just different. So you don't want to.
No, I only had one margarita.
I was going to say, how many cocktails did you have?
I only had one because I was with my mom. And so with her support, she had a Google chart or one of those little charts on all my prescriptions, times, when she gave it to me. So we were prepared. She had gone grocery shopping and she knew everything, what to do. She read through the pre-op packet and was prepared. So I didn't know anything. Course.
Right.
Me. But she did, and she was great. So that support system is important.
Yeah.
For sure.
And just on that vlog and some other things that we have, it really don't feel like you have to memorize or like this is,
right.
Because we're kind of just talking about different things, but we really kind of delineate it like, do this 3 months before, do this a month before, do this a week before, and then even up to the point like the night before, do not eat or drink or anything. Blah, 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 all these things for any type of surgery, but especially for cosmetic surgery, so you have a safe surgery. Right. And, we want to minimize and keep our complications at zero.
Yes.
And we keep it super low because we do those things and make sure that people are healthy.
Right.
And we do have the luxury of saying no to people who aren't healthy. We do nicotine tests before. If it's positive, we cancel or reschedule the case. Yep. So, there's no reason to operate on someone who's actively smoking, and I know they're not going to, have a higher chance of infection.
Correct.
So,
but operating rooms, they're fun. I'm excited to go back in 2 days. But when we were talking earlier about surgeries, we were talking about our first experience in the operating room.
Yeah.
So, you want to start us off?
So, well, let's hear Amber's first experience because mine, being a resident and all that sort of stuff, we have a lot of experiences. But I want to hear Amber's first time because you were actually working for a plastic surgeon in California.
Yes.
And so how did that go?
So I started working in plastic surgery when I just turned 19.
Okay.
I was working for a plastic surgeon in Santa Barbara, California.
Okay.
And I think it was like my second day. I was doing front desk, and my second day, the doctor said, well, come on, you want to go see a surgery? I was like, sure. And so he let me go in, and then they started. And right before he started, he said, are you okay with blood and smells? I was like, yeah, I'm sure I'm okay. He's like, okay, if you get lightheaded or feel like you're going to pass out, I need you to just sit down immediately.
Right.
And then like maybe 20 minutes into it, I think the bovie started and the smell started, and I think he could see my face. So he just kicked the chair to me, and he's like, sit down now.
Right.
But then I got used to it. And then a few weeks, few months later, then he taught me how to scrub in, and the rest is history. Now I can go in and it's like, doesn't even bother me at all. And that was my first time.
And now you smell the cautery smoke, and you're just like, oh, this is like.
I don't mind it. Is that weird?
No, you like it.
It's
I like
gasoline.
the smell.
Does anybody like the smell of gasoline?
No, I hate the smell of gas, but I like the smell of a bovie.
I don't mind the smell of gasoline, but the scent of a bovie, I'm like,
really?
Sometimes it depends.
I kind of like
Sometimes
it.
It's super strong, and I'm like.
Like when we do lasers to the face, I kind of like the smell of it. It's so weird. I know.
It's like burnt human skin.
Burnt
you are
flesh
disgusting
over there.
So gross.
But normally we have a smoke evacuator.
Yes, so you don't smell it.
Whether it's in the med spa or in the operating room.
Yeah.
Because
but this was like almost 15 years ago. It was a long time ago. Did they have those back then? I don't even remember.
Probably not.
Yeah,
people were like just
outdated.
I found that job on the ads in the newspaper.
Oh yeah.
So I don't know if they had a bovie back then.
Oh my gosh.
Do you remember looking at movie times in the newspapers? Yeah.
Yes.
Now we just look on our phones.
Yes.
But I don't know why I thought about that, but yes.
Old school.
So that was my first time in the OR.
Yeah. So my first time in the OR. So remember, I really didn't go to the OR before I was in medical school, right? I never really had an experience in the OR. So my first experience was actually in the cadaver lab in medical school.
Oh,
so
really?
It's not even the OR,
I feel
right?
like that's worse.
It's a little bit strange because you are, working on people like dead bodies, corpses. But I think it's a wonderful thing.
I don't know about that. I would rather be in the OR.
Yeah. So it is a little strange because you see, it's their whole body. They're dipped in this big box with formaldehyde. So there's a certain distinctive smell.
Wait. They're like in liquid?
Yeah. they're like submerged in a.
Oh, so they're not like just like on a table?
That's what I thought, on a table.
It's a box that, on the side you press it down and then it levers it up. It levers the body out of the box.
Oh, this is legit.
Then, and there's fluid inside the box. So when you drop the body back in, it's then submerged in formaldehyde so it doesn't, necrose and dissipate.
So you had to practice on those?
Well, that's how we did our dissections and learned anatomy. So, as a first-year medical student, you're learning the entire anatomy, whether it's the face, the brain, the neck, the chest. So you're dissecting everything.
Yeah. That'd be cool.
Cool. The first couple of days, you're like, wow, I'm working on somebody who used to be walking around.
Yeah.
And there you see the whole, face and body. And but it's nice because these people donated their bodies to science.
Yeah.
So,
that is awesome.
So I think it's really a wonderful thing that these people donate their bodies. So you can do that too, right? Put it in your will or something and say, I want to donate my body to science. And then you never know, they might use it in a cadaver lab versus some sort of study. I don't know how they decide it, but we had a female and and other people had males and
they're naked.
They're naked, and so it was kind of cool,
right? That's a stupid question.
They're not going to be enclosed. That was really
I don't know if they're like covered.
No, they're
they're dissecting their whole body apart.
Yeah.
I'm just
so they are naked, and it's kind of neat because some bodies, obviously you would switch sometimes because if you had a female, you work on the female part, and then if there was a male, then you go to the other one just to look at the male parts, uterus, that sort of stuff, but. Sometimes the female or the male, they would have implants. So I remember our lady had breast implants.
Sweet.
But then we would get, some males who had some penile implants.
Oh, wow.
Not for aesthetic reasons. These are usually prostate cancer. So they had to have some sort of prostatectomy, and then, they weren't able to have an erection. So they just put in an implant to give them an erection. But it was really cool. So that was really my first experience there. So with a cadaver lab, you're kind of prepared. So actually going into the OR, it was a little bit different. I wasn't that like, to see someone in the cadaver lab was more like, whoa, that's kind of, step back a little bit. But in the OR, it was a little bit easier.
Well, I can imagine the cadaver lab would be a little bit more than the OR.
Yeah. Scary. And it's, in the OR, right, everything's draped.
Yes,
so when you're working on somebody, let's say we're working on someone's breast, right? Yeah. The only thing you see is the breast because everything's really prepped. You're not seeing their face, their legs, their genitalia. So it's a little bit different. But I would say my first experience was in the cadaver lab, and you just have to get a little bit used to it.
Yeah.
But then after, let's say 3 weeks, people are eating sandwiches and drinking around. You really shouldn't because formaldehyde is toxic. Yeah. But, a lot of people off to the side would be eating and drinking, their drinks, but you're just thinking, gosh, there's someone who's, like
open.
A little bit strange. But anyways, that was my experience.
So when you went to the OR for the first time, you remember it wasn't anything like earth-shattering?
No, but I will say, what's very different is, surgery on someone's belly for, let's say, a gallbladder, liver, not that big of a deal. But when someone's giving birth, oh my gosh, there are certain smells to the uterus and the fluid that comes out with a baby and the afterbirth, the placenta.
See, when I had London, I don't even remember any of that.
It's a very different, pungent smell. And I remember thinking, man, I'd seen everything. And then when I see someone giving birth, I was like,
that one was gross for you?
I felt really sick and nauseous. And then that like sort of placenta coming out. Oh. It's very hot and warm. And I just remember thinking, that's just so weird. It's neat because you see someone, baby born, but oftentimes you're kind of just catching the baby. Yeah. This is in residency, catching the baby, passing it off to the nurses. And then you got to deal with like all the stuff that's coming out. And the smell was like
too much.
I felt like I almost puked a few times.
That's crazy. I don't remember.
So you've had to deliver a couple babies then?
Yeah.
Oh my gosh, that's awesome. I don't even know. So in residency, you get to do like everything.
Yes.
Because you rotate through different specialties. So the main ones are going to be medicine, surgery, OBGYN, and psychiatry.
Yeah, I was gonna
say and then all the subspecialties out of that, then you would, do. Yeah. So surgery, right? I mean, there's general surgery, cardiothoracic, plastic, OBGYN, there's even different things like infertility. People just do gynecology or doing, removing people's uteruses, ovaries, or delivering babies.
Yeah. Interesting.
And psychiatry.
Right.
So yeah, very, very interesting. But the baby delivering, that was kind of
too much for you.
Too much. The smell. Have you ever? Well, it's not like.
Well, I gave birth, but I don't remember the smell.
Yeah. Well,
but that was also like almost 11 years ago.
Yeah.
Jeez. Were you like 100% awake for that all, or like did you get like?
I was in labor for.
You didn't have a C-section.
No, right. God, I was in labor. I started. My water broke like at 10 a.m. I didn't have her till 2 a.m.
Oh wow! So you're in labor for a while?
Long time.
Yeah. That's painful.
Super painful.
Yeah.
I didn't do an epidural, I think, till like 8 p.m., 9, because I was like determined I didn't want to do it. And then finally I was like, give it to me.
Yeah. Yeah.
How does that even happen? Like, I don't know how that stuff works.
Dude, it's like
you don't want to know
surgery.
For a while.
It's like plastic surgery. You're like, I remember when I had my tummy tuck last year, I told Dr. Najera, I'm never doing this. I'm going to tell people don't do it. And now I'm like, let's do another surgery. Right. So it's like you have baby, you're like, this is horrible. And then people have like 10 kids. So it's not that bad.
That is true.
And it should get easier too, right?
Isn't it supposed to get easier?
Yeah. I think a lot of times because when you're pregnant, you have a lot of changes in your hormones. One of them is, I think, progesterone. It actually loosens the ligaments in your pelvis. So people's pelvises actually dilate a little bit.
Yeah.
And the tissues stretch out. So the second time around is always going to be a little bit easier. Have you ever heard of those ladies who just deliver like in the car? And they're in labor for like maybe 10 minutes, right? As opposed to their first one where they're in labor for hours.
Yeah.
So it gets, progressively easier.
Muscles are looser. Everything's just flowing on out.
Dude, I was like a fat cow too. I gained so much weight when I had London.
Really?
I was 117 when I got pregnant. And when I gave birth to her, I think I was 192.
Oh, wow.
Oh, dear.
Or
were you just eating away, or was it?
I was
she was
eating
a heavy baby.
A Wiener Schnitzel. Shout out to my Californians. I don't think you guys.
No,
have Wiener Schnitzel here?
I grew up in El Paso. There was a Wiener Schnitzel in El Paso.
Wiener Schnitzel.
That is a hot dog corn.
Chili cheese fries.
Yeah.
That and Dr. Pepper and milk. Oh my God, I used to drink. I remember my doctor told me I had to stop with the milk. I was drinking like gallons of milk. It was a problem.
Do you think when I did liposuction a year ago, I was liposectioning some Wiener Schnitzel and chili cheese fries?
Probably for
from
sure.
From like the 10 years before.
Totally.
I wouldn't doubt it.
Yeah. Jeez. But yeah, so I mean, the kind of experiences that I got in medical school were really, interesting. I was telling you guys earlier that one of the experiences I had in the ER, this wasn't really me, but kind of seeing someone else's first reaction to seeing blood or something like that. So this was in Chicago at one of the hospitals there, and I was one of the surgical trauma residents. And so a young girl, she was in her 20s. I guess she was depressed. She tried to kill herself, so she cut her wrist.
Yeah.
But it was superficial. She really just got the veins. So when she comes in, they asked us, the surgical resident, hey, she's got multiple cuts on her wrist. Can you suture it up? So I go in there and I start suturing. But anytime someone has sort of, diagnosis of possible suicide, depression, they bring in the chaplain. And the chaplain at the hospital was this nice young man. And he proceeded to start talking to her while I was suturing her up. And she wasn't bleeding that much. Yeah. Maybe a little bit here and there. And I was putting in, 5-10 stitches. No big deal. Right. But I think he had never seen that before. He was new. And so he was talking to her like, hey, where are you from? And, what sort of your support system? And all of a sudden he starts slurring his words. He's like, so your mom is blah, blah, blah. And I was like, what? Why is he mumbling like that? And I turned around and he looked white. And then he kind of, most people when they start feeling faint, they go, I don't feel right. And then he just kind of slinked over and his head hit the back of the wall. And then bam, it hit, just made this big noise. Jeez. And so he passed out for like a few minutes, but he had a real concussion because the ER docs came in and they took him off. They had to do a CT scan of his head. And, but someone's first time seeing that stuff, everyone reacts differently.
Totally.
And I think it just kind of overcame him and overwhelmed him.
Yeah.
But a lot of medical students even have that sort of reaction the first time in the OR. And that shouldn't make anybody fearful of going into medicine. They do that the first time and then it just becomes like second nature after that. So, I know a lot of people who go, oh, well, I would love to do medicine, but I just hate needles or I hate blood. I'm like,
used to
you're going to get over it. It's no big deal. Who really likes blood in that sort of situation or needles? So it's just one of those things. But have you ever had, it's that sort of we call it like a vasovagal reaction when someone sees blood.
Yes.
And they're basically what happens is your vessels vasodilate. Yep. So all that blood rushes to your feet. you don't get anything to your head and you pass out. Nothing like that has happened to you, Anjelica?
It happens to my dad, and I think I picked it up. Whenever I give blood, I get like super ghostly white, nauseous. Really? Yeah, I did it for the first time. It was like like you donated blood in high school, and it was like, stop by during one of your free periods and do it. And I was like, you know what? I'm going to be a good person. I'm going to do it. And so I went and did it, and they looked at me. I was a ghost. I had a stress ball. They're like, oh, you have great veins. Like, I was still pretty ripped in high school. Yeah. And I stood up and walked into the bathroom, and I was just like super nauseous, drenched. So
you'd already given the blood?
Yeah, I had just given it.
Don't you have to sit there for a while when you get blood?
They wanted me to, but I was like, I need to get up. I need to get out of this chair.
Yeah.
I need to get water. And even when I go to the doctor now and they just do simple blood tests, like, I get super nauseous still. And I'm like, I'm soaked in sweat. I don't know what it is.
But you're able to Snapchat all our surgeries.
My first time ever being in the OR, okay, I was standing there. I don't remember which anesthesiologist it was in there, but they were like, have you ever seen any of this before? And I was like, no. Totally freaks me out. I'm scared of it. I can't even look at my own blood. Paper cuts, I'm nauseous. Scrapes on my knees, gone. So I'm standing there, and I think, I don't know what you were doing. It wasn't even like that big. I couldn't even watch our Snapchats when I first started here.
Really?
The tummy tuck, like when you lift it up with the hamburger flipper thing.
The hamburger flipper. Or Richardson retractor. Can I have the hamburger? Flipper?
Oh my God.
I literally... I every time that would come on our Snapchat, I would zoom through like, so grossed out. But over time, like I remember them looking at me and they're like, if you start to get, nauseous or anything, bend your knees. So I was standing there in a full like mini squat, like bending my knees. I was like, oh my God. And I like the smell. I wasn't used to it. I was just like, okay, this is really cool because I've never seen anything like this before. But I was not used to that. It took me a while. And then I think the one that freaked me out the most was a brachioplasty. Like me actually being in there.
The arms?
Yeah, because I'm like so used to like working my arms out so much that I never really like paid attention. I'm like, oh my God, that's the muscle. That's the bicep. Oh,
I think
super
it's
cool.
So cool.
Oh my God, it's so cool. But
yeah, I mean, it sounds like you just kind of had that real reaction where it just, in the whole idea of like bending your knees, I don't know if that really helps. If it's true, like a vasodilation, it doesn't matter if you're squatting, whatnot. The best thing is really just to, either lie level, or sit down. So basically you're just trying to prevent you from falling real hard. If you're sitting down, you just kind of slump over. And, I think I tell anybody who hasn't seen anything before, I say, listen, if you haven't seen it before, at least stand, against the wall so you can sort of slink down if that's the case, or sit down in a chair. But I think that's kind of common to most people who are seeing something.
Yeah. So, now we're all good. I'm in there all the time.
No big deal.
Just hanging out.
You get used to the smell and like the noises and everything becomes second nature. But I do remember the smell, the Bowie smell, although I like the Bowie smell.
See, I'm not the only one.
It's like the smell of gasoline. I'm kind of weird. I kind of like the smell of gasoline. I mean, I'm not going to.
I don't know about gas, but I like the smell of surgery.
Smell of surgery. Yeah.
See, Bowie smell doesn't bother me. I just, when I'm like,
Yeah.
And if it gets really strong and the little smoky thingy isn't working, then I'm like,
yeah.
Oh, see, I like
I'm going to step out really quick.
Well, we have a smoke evacuator, which basically suction to get all that stuff. And it is important, as much as it, some people like it or not, it is like smoking a cigarette. Like there's so much that over time it can hurt you, even if we're wearing the mask. So that's why we use a smoke evacuator, really just to kind of prevent us, as healthcare workers, doctors, assistants from inhaling it. Because I think there was a study that said if you inhaled an hour's worth of cautery, it's like smoking a pack of cigarettes.
Really?
Yeah. So it could be equivalent as far as the damage that's being done as, cumulative over time. So I think it's really important that we have the suction, evacuator. So.
Well, that's cool.
Well, I'm excited for your surgery coming up in a couple of
days. Do you get excited to operate on me, or do you get a little nervous because of how crazy I am? Be honest.
Well, no, I mean, I want to do a good job. But I think, I would say it's sort of like going to a game, right? Like the playoff championship, whatever. You have a little bit of the jitters beforehand, but once you get in there, it's just routine.
Yeah,
and that's the biggest thing for myself. I don't want to stray too different from what I normally do because that's where I think people get in trouble. It's like, oh, I'm going to do this much extra and really liposuction. Well, you might get in trouble and, because you're trying really hard. So I really try to remind myself, just do what you normally do. and not try to do anything more or less.
Yeah.
And she'll be okay.
Yeah.
And then we don't have to deal with any, issues, that sort of stuff.
Yeah.
Like pulling, let's say like a tummy tuck, right? Pulling really tight.
Right.
You kind of learn from experience that sometimes pulling too tight's too much, making belly buttons a certain way, making the breast really tight, or, you kind of learn that, hey, some things require a little, love and TLC.
Right. Yes.
And you just don't want to stray too far from the norm.
I mean, hopefully she doesn't wake up looking like that again.
I know.
Oh, gosh.
You had to wear my socks that I got you on Thursday.
Yeah.
Drink out of your coffee cup.
Oh my God. If I look like that again on Thursday, can someone please make sure I look somewhat decent before my husband picks me up?
Oh my gosh.
Could you imagine if Sean walked in the door and I look like that?
Yeah. Are you going to have everybody taking pictures of you?
No.
Like you did last time?
No, well, that face is because they were taking photos of me and I told them to get away.
I can see that.
They were like, I could hear them saying, oh shit, she saw us.
I do remember that. I did say that when you looked and your eyes were like, they were huge. I got a death stare. I was like, oh shit, we gotta go. Everybody out.
Hopefully I won't be that bad.
Well, that's going to be in a couple days.
Yes.
Make sure you stay tuned for our next podcast. We'll have a little bit more to say about that next surgery.
Yes.
Although you might not be here.
I won't be here for the next
in recuperation. At least
we will.
Yeah, we'll be here. We can talk a little bit about it. And then when you come back, you can definitely give us a little feel for what it was like, the second time around.
Yes.
So anyways, thank you guys for listening. I'm Dr. Dallas. We have Amber. Thank you for joining us.
Of course.
And Anjelica, thank you again.
You know it.
Good luck with a new car.
Yes.
Oh, thanks.
Yeah. You can give us a call if we need to push you to the gas gas station.
You never know.
But we'll see you guys next time.
All
Thank
right,
you for
bye,
listening.
guys.
Bye.